A very good evening to all of you present here. I hope am I audible to all of you. So good to see you all of you to enter the master class, and also good to see on this, especially on the Sunday evening. Okay, and I'll try my level best to make this Sunday more educative and more innovative, and to make more enjoyable during this master class. This is let me introduce myself. This is Jyoti Pachisia here, faculty from NIND, and today we'll be having a discussion on one such particular topic, which is underdiagnosed, which is something we, yes, we know about this, but at the same time we are not aware about this. This is actually in between this way. So without any waste of time, I'm going to share the screen so that you people can understand what topic today we are going to discuss. And if you have any queries or something, you may put it in the chat box. Post my thing, I'll able to answer your questions. Okay. So today's masterclass is focused on the endometriosis. I'm sure you people have heard this term. I'm sure you people may be aware about this term, but at the same time, I will also say you may not be aware about the behind this term as well. Like, you may come across many people discussing about the periods, but no one actually express the exact symptoms that they are facing. Many people actually fail to do so. Like, I'm sharing you one, I'm actually telling you all one script where it's mentioned. It's a conversation between the two friends, where one friend is mentioning, I hate sports day. The other one asked why. So the first one said, she actually confided in a way, I'm on my period. And nowadays, my periods are infrequent, but sooner become more regular, heavier, and increasingly painful. She is deal. I also deal means the friend. She is continuing her conversation, dealing with bloating, nausea, cramps, dizziness, often ending up on the floor in discomfort. Even if we talk about the remedy, she was continuously explaining this fact that every remedy was explored, whichever available, like paracetamol, ibuprofen, hot water bottles, heat patches, but nothing elevated. She even made sacrifices, cancelled plans, and fabricated excuses out of embarrassment. Now, when she was even again expressing the fact that whenever it's a matter of a discussion about her struggle, especially and when she has to discuss with the men about it, maybe with his boyfriend or maybe with her husband or a father or anyone it be, uh, often we, and if you will see also, you often face this dismissive remarks like, I don't need to hear about your lively issues, and that how makes us isolated. How many of us are actually experiencing this? I'm sure everybody is hearing about this. Even if you are not, you see your dear ones facing this. And if it is so, it is an alarming rate. It's a high time now to make the people, to make aware, everybody aware about this thing, that this cannot be ignored. Okay. So today's topic is very much connected to this. The script which I actually mentioned, it is actually it's been actually for a patient. My thing that this one or two a thing that she was facing when she was suffering, when she finally came to know that she is suffering from endometriosis. Now, before we jump into the what is endometriosis, we need to first understand that what is menstrual cycle. So, unlike male reproductive system, this female reproductive system undergoes regular cyclic changes, which is known as the menstrual cycle, which serves as the body's periodic preparation for ovulation and potential pregnancy. Now, as per the organization called FIGO, that is the International Federation of Gynecology and Obstetrics, normal menstrual cycles should have consistent frequency, regularity, duration, as well as the volume of the flow. The cycles occurs every 21 to 35 days. In some insights, you may find it may be 24 to 38 days. So it's fine, but more than 38 days is not desirable, because if it goes longer than 38 days, it is infrequent. Whereas if a cycle length is less than the 24 days, it is frequent, which is again a harmful thing. Normally, bleeding lasts 8 days or less. That's normal. That is actually that is said as normal menstrual duration. But beyond is considered a prolonged menses. Okay. Now, we all are aware about the different phases of the for menstrual cycle. Like it is actually divided into 5 phases. First phase, and what are those five phases? Let us understand more in details. So, the first phase, which is starting, is the first phase is the menstruation. Obviously, the day one, which is 1 to 5, where there is a hormonal changes, estrogen, progesterone levels are low. Then there's a physical symptoms. Then the emotional symptoms are experienced. Phase two is the follicular phase. If you can see, it's from day 6 to 14. Estrogen levels are increased, follicle growth stimulated. Then there is an physical symptoms, there is an increased energy, improved mood, because during menstruation, obviously we are aware that how mood swings, makes us a dangerous one, right? So improved mood, then increased confidence, we tend to interact socially more better. Phase 3 is the ovulation phase, where it's from the day 14. Again, there are some like estrogen surge triggers luteinizing hormone release, causing ovulation. Then there is a increased cervical mucus, mild pelvic pain is observed, and along with it, increased libido, feeling of attraction, social interaction is seen. Phase 4 is the luteal phase, where progesterone levels increases, preparing the uterus for the implantation. Of course, there's a mood swings, irritability, anxiety is being very common. Now, why do we need to understand this menstrual cycle? Because if that is not happening, if this is not happening, then the uterus sheds its lining, causing a period and the start of a new menstrual cycle. But what if this is only disturbed? And as a matter of a fact, either there is a missed periods, or is it or it can be a really, painful periods. And that is somewhat is being depicted to endometriosis. So what is endometriosis? Endometriosis occurs when the cells from the uterine lining, that is the endometrium, grows in other parts of the body. Typically seen inside the pelvis, around the bladder, bowel, or the uterus, but it can also spread outside the pelvic cavity. Now, what happens is during menstruation, this endometrial tissue also bleeds, causes inflammation, scarring, and adhesions. And these lesions, however, have a proliferation of the nerve endings, which becomes sensitized. That's why we often say this: endometriosis is an inflammatory disease. Okay, many people, it has been seen that it has been categorized as a gynecological malformation. It's something like that. Yes, it is a gynecological malformation, but if you have to specifically categorize it, then it comes under the inflammatory diseases, because many researchers have also identified certain biomarkers also, which are solely responsible for the development of endometriosis. Okay. Now, growth of the endometrial tissues outside the uterine cavity, this is seen. Any structure in the body can be affected. It's not necessarily just because it's that happening in reproductive system, it will be seen in that area will be affected. It's not like that. It can affect to the other parts of the organs as well. Spleen is the only exceptional one which is not affected by the endometriosis. This is a newspaper report which was taken from the this is from the Times of India, where it's actually mentioning that endometriosis affects around 2.5 crore women in India, which is 4 out of every 100 women. According to World Health Organization, this condition is believed to affect 10%, that is 190 million of the women worldwide which are of reproductive age. Despite its prevalence, endometriosis often goes undiagnosed or misdiagnosed due to lack of awareness among the general public. This is very unfortunate, but is actually true. Let us understand how and why. See, endometriosis is a painful and emotionally draining. If I talk it in more like a, if I use some movie language, so it is a sneaky villain. Just like in a movie, we see one villain, we see two villains, and as the subordinate villains like that. This particular endometriosis is a sneaky villain which thrives on misconception, commonly being taken on something that is not. And in fact, faulty understanding of the condition causes pain and even causes economical burden to both individuals and society. Because endometriosis diagnosis now is not so very well done, except in laparoscopy. Now, from the laparoscopy point of view, you can actually identify those factors which can get converted to endometriosis. But we do not have any particular test till now for the endometriosis, especially in India, if I talk about it. People with endometriosis, in fact, is also seen they are commonly misdiagnosed with the other conditions. For example, if I talk about inflammatory bowel disease, inflammatory bowel syndrome, solitary rectal ulcer syndrome, colorectal cancer, ischemic colitis, metastatic tumor, it is sometimes very difficult to undetect also, because most women become accustomed to painful menstrual cycles at an early age. So this disease will often undergo undiagnosed, because most of them say, "Are mera, there's a painful periods are often painful to me, so it's like fine, I'm okay with it." So even with extensive endometriosis, it's possible to have minimal symptoms or none at all. Though physicians have identified few diagnostic tools, but again, it's just to detect the scars and the growth of endometriosis. We still are yet to be understand or isolate the other tools which can be not only economically saving point of view, but also accurate enough to understand the diagnosis of endometriosis. Now, what is the details of the endometriosis? That means I'm talking about the what is the anatomy scenes, or the, you can say, the pathophysiology scenes for the this one endometriosis. So let us understand that. So before we jump into this, into about the direct what is the scenario, we need to understand certain theories, because once we understand the theory of endometriosis now, then only we can actually catch up with the this one, pathogenesis of this one. So as you have understood a bit that it is a complex, थोड़ा term से समझ में आ ही रहा होगा that this is a bit complex. So it's a complex multifactorial disease. Several theories have been proposed to explain the development and the progression. Okay, if you can see in this picture, we have the four theories out here. Regurgitation theory, which is the most favored one. It was proposed by Dr. John Sampson in the year 1927. And he was the first one who brought the concept of the retrograde menstruation. We'll study about this, don't worry, and how that is leading to implantation. Followed by the other theories, we have benign metastasis theory, we have the metaplastic theory, we have extrauterine stem or progenitor cell theory also. Okay, so let us understand each of them in detail. Plus, along with it, we will also understand some of the more theories which are directly or indirectly connected to endometriosis. So the first one, that is the regurgitation theory. As I already mentioned that this was proposed by Dr. John Sampson in the year 1927, and it's considered to be the most favored among all the theories. Now, what this theory actually says, according to this theory, endometrial cells flows back through the fallopian tubes and into the pelvic cavity during menstruation, leading to implantation and growth of the endometrial tissue outside the uterus. That means what? It is actually, and this is happening when it is happening after retrograde menstruation. Now, what is retrograde menstruation? Retrograde menstruation, again, it's a common one. It's a common, but again, it's not necessary that the person who is facing this retrograde menstruation will develop into the endometriosis. What is the main hypothesis, or what is the, you can say, the concept behind the retrograde menstruation? It is actually, firstly, if before you go into the hypothesis, let's understand one. Retrograde menstruation is a phenomenon where menstrual blood flows back through the fallopian tubes and into the pelvic cavity inside, and instead of being expelled from the body through the vagina. Okay, so endometriosis may develop when there is a decreased clearance of the viable endometrial cells from the peritoneal cavity, suggesting a probable immunologic factor. So this clearance, if it is not happening, that means the person has developed a retrograde menstruation, and can be a high chances that if this goes on, then the person may develop endometriosis. Second one is the benign metastasis theory, which is happening via blood vessels and the lymphatic to distant sites. The third one is the metaplastic theory, where we can see the mesothelium, means the middle layer of the pelvis and the abdomen, undergoes certain metaplastic changes which gets converted into endometrium. Then we have the last one, that is the extrauterine stem or progenitor cell theory, where it actually says that the circulating stem cells of the bone marrow differentiates into the endometrium. Now, apart from these, we also have environmental toxin theory, we have microbiome theory, we have also immune system dysfunction theory, also hormonal influence theory, and one more, which is I say that it is the embryonic cell displacement theory. This theory was actually proposed by Dr. Robert Goodall in the year 1943, and according to him, the theory actually want to say that the endometrial tissue is present in the pelvic cavity during embryonic development and becomes activated later in the life. So these are the concerning theories to be taken care of. Now let's understand what are the symptoms associated with it. So the symptoms, if you can see, it's a range of the symptoms we can see, but you need to distinguish very well that which one that actually comes into the endometriosis, because these are the again symptoms which we commonly face, but we fail to understand that this can be linked to endometriosis. First one is the pelvic pain, where chronic pain is experienced in the low pelvic area, lower abdomen, or lower back that can last 6 or more months. Next is the painful periods, which can be cramp or the pain. That's why it is sometimes endometriosis is often referred as the killing cramps, because the cramps are not normal at all. Cramps or pain in the lower belly may begin a week or two before your period and can range from dull to severe. Pain during or after sex, which is termed as the dyspareunia, that means pain during or after sexual intercourse, is another frequent symptom. Pain with the bowel movements or urination during ovulation, bleeding, which is actually depict like this one, heavy or prolonged menstrual periods, and spotting or bleeding between the periods. These are the range of the symptoms which we see in the endometriosis. Now, what are the other symptoms which can be combined or which can be seen clubbed with this? Infertility, fatigue, extreme tiredness or fatigue is another symptom, gastrointestinal issues, mood changes. Okay. Now, what are the complications associated with the endometriosis? See, if we talk about the complications of endometriosis, it depends upon which type of endometriosis is actually developed inside the body. It could be lesion endometriosis, or it could be the systemic endometriosis, or it depends. It can be ovarian endometrioma, it can be peritoneal endometriosis, or any other type. It depends where the endometriosis is actually happening, which area is the most affected. Depending upon that, how it is developing the complications. So like one example, one complication is seen is the infertility. Approximately it is seen that 1/3 to 1/2 of women with endometriosis found difficult getting pregnant. For pregnancy to occur, an egg must be released from an ovary. That's what we know. Travel through the neighboring fallopian tube, become fertilized by a sperm cell, and attach itself to the uterine wall to begin development. But in case of endometriosis, this is not happening. What is happening is that endometriosis will actually obstruct the tube and keep the egg and sperm from uniting. Okay, so this is the one such complication. Second complication is the cancer, which is actually termed as endometriosis associated adenocarcinoma, which can develop in later life. Those who have suffering from endometriosis, if it is detected in the mild stage of endometriosis, with the help of dietary lifestyle, the diet and the lifestyle patterns, you can actually overcome the symptoms of cancer even. Now, these two were the complications most commonly seen. Now, which are the myths and facts associated with the endometriosis? Now, there has been seen certain myths and facts which we sometimes fail to understand them. Let us understand them in detail. One myth is period pain is normal. You must have a low pain threshold. See, this is the one. But the real fact is, if the pain is severe, which is termed as dysmenorrhea, with menstruation is not normal and can be caused by endometriosis or other related conditions. Another one is, everyone who has endometriosis has severe period pain. No, this is wrong. Many individuals you may come across, they may not have any symptoms at all. We just came across about this. Having a baby will fix endometriosis. Again, a no. Endometriosis symptoms can appear to improve during pregnancy due to changes in the hormone levels. These effects may only be temporary. Symptom recurrence can occur. If you have endometriosis, you can't have children. See, it's not like that. It's difficult to conceive, but there are some cases which have shown that women with endometriosis can have the ability to be conceive also. Hysterectomy will cure the disease. It's not necessary. Surgery alone cannot do everything. Your dietary, your lifestyle patterns are also essential. Only that can actually prevent the disease to deteriorate. Now, what are the current treatments that we see in the endometriosis? In current treatments include analgesics, which includes your NSAIDs. We all know which NSAIDs are we talking about. That is the ibuprofen, Advil, Motrin IV, many others. Or naproxen sodium, that is LV, to help ease painful menstrual cramps. Second one is the hormone therapy, which we call it as the HRT. Hormone medication may slow endometrial tissues growth, and in this way, it will prevent the implants of the endometrial tissue. Again, as I said, analgesics, even your hormone therapy, are not considered as the permanent fix for the endometriosis. These are the certain agents, examples you can say, where it covers the analgesics also, as well as it also covers the medicine, that is the hormone therapy medicines also. If you can see, this is the example of hormone therapy, which is considered as the first line agents for the endometriosis associated pain. And these are the examples of the other agents. That means I'm talking about those analgesics which are associated to relief from endometriosis associated pain. Like we have GnRH analogs, we have danazole, aromatase inhibitors, NSAIDs, like this one. Now, what are the other therapies which are used to treat endometriosis? We have hormonal contraceptives like birth control pill, patches, vaginal rings that help to control the hormones responsible, and also they are responsible for the build up, those hormones which are actually specifically responsible for the build up of endometrial tissue each month. Second one, we just saw the name, that is GnRH agonist and the antagonist. What will they do? That will actually block the production of the ovarian stimulating hormones, lowering estrogen levels and preventing menstruation. So what will happen? This will cause endometrial tissue to shrink. Okay. Then progestin therapy. There are many progestin therapies available, including devices are there, IU devices there. But you need to know and you should be properly trained for this therapy. Okay, because you, if you are properly trained, then only this therapy can be successful. What will this therapy will do? This therapy will actually halt the menstrual periods and the growth of the endometrial implants, which may relieve endometriosis signs as well as the symptoms. Of course, surgery was there. One we just saw was the hysterectomy, which can be sometimes used to treat the signs and symptoms associated with the endometriosis. And another one is the laparoscopic surgery, where the surgeon actually inserts a slender viewing instrument, that is called the laparoscope, through a small incision near your navel, and inserts the instruments to remove the endometrial tissues through another small incision. After surgery, doctor might recommend taking hormone medication to improve your pain. So these are the certain more treatment options for the endometriosis, like we to improve your fertility, which surgery or IVF, IUI medication, which therapy can be used, which is more effective, which is not effective, how far is the costing that need to be taken care of, everything that is mentioned. Now, Endometriosis, if we are talking about in terms of the lifestyle patterns, yes, exercise is one such them. Exercise, if we do simple, if we are doing the walking, if you are actually doing the skipping, then cycling, that actually really helps a lot to overcome the or to prevent the deterioration of the symptoms of endometriosis. Here's what the research actually says. Number one, exercise actually helps to uplift the mood of a person, particularly when they are suffering from depression, along with the endometriosis. Second thing, exercise can be a part of the multi prolonged therapies. Actually, this therapy is something which you keep on doing, and that's actually really helpful to treat endometriosis pain, because it helps in loosening a variety of the ligaments and muscles, which allow a person to move better despite those irritability pain. Additionally, exercise increases serotonin levels and increases opioids, which helps in managing the pain and your mood swings also. It has, especially if I talk about the aerobic exercises, it is confirmed that women who exercised 4 hours a week or a more reduces the risk of the endometriosis by 65% compared to the ones who exercise less than 4 hours a week. Okay, and what can be the recommendation, like running, cycling, playing tennis? Even there is a one more form which can actually help you to overcome this one. There is actually, we will talk about the yoga. Like, this is exercise intensity check-in. See, when we are talking about the intensity of the exercises, you need to make sure that what type of individual is standing in front of you. Only on that basis it is decided that what type of intensity that person can actually take it. If you recommend high intensity exercise but the patient is already suffering from arthritis, it's impossible to for them. You have to start from, make sure that you have to begin it with like walking or chair surya namaskar or something like that, so that the person is not feeling demotivated. Okay, so that is something need to be taken care of. So these are the certain check-ins which you need to keep in mind when you are recommending the intensity of the exercises. Apart from this, there are certain yoga asanas, or you can say the poses, which can actually help to in overcoming the symptoms of endometriosis. First one is restorative goddess pose, which actually help to relieve the pelvic pain, reduce abdominal tightness, balance your nervous system. Second one is the happy baby pose, which is actually called as Anand Balasana. This is good for releasing pelvic floor muscles, low back muscles, inner thighs, and the hamstrings. Next one is the talking about the child pose, which gently stretches your spine, hips, and glutes, helping to elevate the tension, cramping, and the stretch. This one stress as well. Next one is the reclined bound angle pose. Reclined bound angle pose is actually nothing but the it's also called as Supta Konasana. This is actually a relaxing pose which calms your nervous system and relieves stress. It alleviates the tightness in your hips, pelvis, and inner thighs, and gently stretches your stomach, which can reduce the pelvic discomfort. It include Make sure to include this in a low to moderate workouts, which may, like, especially if you are doing like swimming, brisk walking, or cycling as well, you need to do. Now, what is the dietary management of the endometriosis that is need to be taken care of? So when you are recommending a diet, or if you are telling to improve the dietary management for the endometriosis, the main aim is actually to balance, nourish, heal, as well as the support. Because if these three are well balanced, Ultimately, the diet or the endometriosis is also balanced. It's also somewhat like prevented. What is the benefits of this? The benefits are actually it reduces pain, reduces bloating, cramps, reduces estrogen, reduces toxic load, and improvements is like supports the immune system, assist healing the gut, increase energy levels, balance blood sugars, increases nutrients. Let's understand which need to be eaten and which to be avoided. Obviously, the first thing is the fiber rich foods. We all are aware that the estrogen is something, a primary hormone which helps the body to perform functions. And if somehow due to environmental factors, or if I talk about some your sedentary lifestyle, there can be higher chances of developing xenoestrogens, which actually mimics the estrogen, natural estrogens. That actually is one strong factor to aggravate endometriosis and symptoms like cramping, pain. So there come the main role of the fiber rich diet, and in what way you can actually incorporate, like including eat this one raw or the boiled fruits and vegetables, including the flax seeds in smoothies and home baked food items. Then we have the legumes such as beans, lentils, and chickpeas, and also to eat vegetables and whole grains like whole wheat pasta and even brown rice. The moment when we you say that you have to improve your diet, you have to and especially if a patient is obese, you need to minimize the fat, you need to cut down the fat, but don't forget that there are certain good quality of the fats which will help you to improve your symptoms. Endometriosis is an inflammatory disease, I said in the beginning only, right? And as said, inflammation makes symptoms worst. So omega-3 fats, that is omega-3 fatty acids, and MUFA, that is mono unsaturated fatty acids, can help to calm inflammation from endometriosis. Where do we get these? We get from fatty fishes like sardines, salmons, and tuna, avocado, which is rich in omega-9 fatty acids, peanut butter, plant oils like canola oil, flaxseed oil, nuts and seeds like walnuts, flax seeds, and chia seeds. Minerals at need. Of course, we need minerals when it's a matter of balancing the plate. We cannot ignore any of the food group and also any of the nutrient. So minerals comes plays a major role into it, because one research has actually also confirmed that lack of magnesium can increase the symptoms of the endometriosis. So minerals, what do? They actually helps to relax the muscles and regulate the cycle. Apart from consuming the calcium, including the zinc and magnesium, as they are also important minerals. Magnesium packed foods include dark chocolate in small amounts, leafy greens like spinach, legumes like black beans, nuts and seeds such as almonds and pumpkin seeds also. Even we have the contribution is also given from the herbs also, and the some of the good flowers like lavender. If I talk about the our very own haldi, which is called as the turmeric, the curcumin which is present in that, it's known for controlling inflammation and also help in maintaining the hormonal levels. Rosemary, then chamomile, then we have the lavender essential oil. They actually have been shown to lower the pain, um, and also has shown to helping the liver break down estrogen into a safe form, and maintains the hormonal balances and changes the way for endometrial cells to grow. Inflammation and high estrogen levels may worsen endometriosis, so certain food choices may influence it, like trans fat, excessive red meat consumption, excessive intake of caffeine and alcohol, excessive intake of added sugar, and even gluten. See, these all are actually, I will say, bad in the sense you need to make sure you cut down them. Again, if I talk about the gluten, for some it is suitable, for some it may not be. So if a person has developed allergy towards the gluten, then it's better to skip that. It is also important to adhere to a diet that focuses on the variety and the balance for optimal nutrition, because our aim is to make sure that we include almost all the food groups which are the basics of the healthy plate, including fruits, vegetables, dairy, proteins, and grains. And we just came across that why these are essential for our body, and especially if you have to overcome endometriosis. So it's high time now to invest in your health, and especially be make people more aware about the endometriosis. It's the last line which I would like to say. When all you know is pain, you don't know that this is not normal. It is not a women's lot to suffer, even if we have been raised that way, which we are still doing. It is not okay to miss a part of your life because of the pain and excessive bleeding. It is not okay to be bedridden for 2 to 3 days a month. It is not okay to pain during sex also. Thank you so much. And I welcome the questions if you all have honey. Thank you. Yes, Shriyan.
Hi, ma'am. Here, Jyotsna. Actually, I just wanted to know that you spoke about this laparoscopic surgery for endometriosis. So, once it is done, there is any chance of recurrence coming back?
Yes, it can be. There are certain the cases which has been shown that even after conducting the laparoscopic surgeries, there can be chances of recurrence, provided that after doing the laparoscopic surgery, there are something do's and don'ts which you need to follow. And plus, at the same time, as I mentioned, you need to follow one hormone therapy as well. Somehow it gets missed, or somehow if your lifestyle pattern is not up to the mark, there are high chances of recurrence.
So, if hormonal therapy is not done and just with lifestyle modification, and as you told, this aerobic exercise and with diet regimen, so can it be controlled or like it's still the recurrence chances are there?
It can be controlled, but again you need to make sure, like, you have to keep a track of it there. You need to make sure you are keeping a track of it also. Okay.
Okay. And my second question is, ma'am, I heard about this seed cycling therapy or the seed therapy, which is like because of estrogen dominance, the seed
Mhm.
therapy helps to lower the estrogen. So I just want to know what is the impact of this? Like, is this proved one or like it's really relevant? Is there any evidence for this?
See, seed therapy is more of an influence. Right now, it's getting influence is more like a trending therapy. But yes, at the same time, it has been proved by the researchers that yes, if you are following a seed, if you are doing this therapy, it can actually help you to overcome at least uh, not allowing the body to form those mimicking estrogens, which I just mentioned. It's called xenoestrogens actually. So maybe that is helpful in that, and that's how you can actually can be taken as one step to prevent these symptoms of endometriosis.
Okay, fine. And ma'am, last my question is, ma'am, you spoke about this one endometriosis about this regurgitation, something the types of endometriosis, something you spoke. So I was
Yeah,
not
yeah, I
able to.
spoke about the types of endometriosis right there.
Yeah, in that one part you spoke about regurgitation.
Yes.
So I'm not
Retrograde.
able to. Yeah,
Understand.
retrograde. Yeah, yeah, yeah. I'm not
Okay,
able to
okay, okay.
understand that.
Okay, okay, not an issue there. So, retrograde menstruation, as I mentioned, firstly, what happens is that, sorry, uh, Retrograde menstruation, if I say, how is that connected to the endometriosis? I'm telling you once again is, see, retrograde menstruation firstly is a phenomenon. Okay, it's a phenomenon where menstrual blood. Now, normally what is happening during menstruation, what is supposed to be done? It should actually moved, it should be expelled out from the fallopian tube and from the pelvic cavity or something. It's
Right.
not happening in that case. In case of retrograde menstruation, it actually, what is happening, menstrual flow is actually coming back through the fallopian tubes and into the pelvic cavity, and that is somehow is getting settled, getting settled. So what is happening, what, during this course of time, some of the blood will flow back through the fallopian tube and into the pelvic cavity. This retrograde menstrual blood which we are depicting, because it's coming flowing back again, it can contain endometrial cells. So these endometrial cells starts causing inflammation. It can implant and can grow into the pelvic cavity, and as a matter of fact, because it causes inflammation, it results in the scarring in the pelvic cavity, leading to the pain as well as the other symptoms. Now, there are certain researches which actually has shown or which has proved that retrograde menstruation is one such contributing factor in the development of endometriosis. At the same time, it has also shown that it can play an important role in the development of the pelvic pain and other symptoms which is associated with it. So depending upon the how menstruation is going on, the how the settlement of the endometrial cells are actually happening, there are coming up with the different types of the endometriosis. And retrograde is one of the most common, which again, unfortunately in India, many women cannot understand that this is actually a retrograde endometriosis.
Okay.
Yeah.
Thank you, ma'am.
Welcome, Jyotsna. Arshia, you have asked a question, dear. Is there any correlation between endometriosis and ectopic pregnancy? Okay. So, my answer to this question is somewhat it is connected, but indirect way. Actually, to be very honest, endometriosis and ectopic pregnancy, they are two distinctive conditions which can affect, of course, the women's reproductive health, but it is seen that women with endometriosis can have an increased risk of ectopic pregnancy. Both of these conditions are related to the hormone and the reproductive factors like abnormal implantation, inflammation is associated. And it is also seen that ectopic pregnancy can be more complicated in women with endometriosis because of the formation of the adhesions and the scarring and the continuous inflammation that is happening in their body. So yes, ectopic pregnancy and endometriosis can be direct also, can be indirect also, but somewhat connected to the women's health for sure. I hope I am justifying your answer, dear.
Yes, ma'am, it's clear. Thank you.
Okay, Ashia. Any? Yes, Savita.
Ma'am, I wanted to know what are the diagnostics tool for this endometriosis.
Okay, diagnostic tool for endometriosis. See, one is of course laparoscopy, where we actually help to identify that what is the situation of the endometriosis. This endometriosis. I mean the scars and all. How much is that level is being done? And apart from this, if I talk about in India as such, there are, or if I say, there are very rare tools you can say to assess the or predict the exact endometriosis. Okay. So, like
Okay.
if I talk about imaging test, like we have MRI, we have
Hmm.
done USG also. So, what they will actually help you, they will actually help you to identify those cysts, that is endometrias, which we say endometrias cysts and adhesions which are located in the pelvic cavity. That will be written in as an interpretation. If I talk about MRI, MRI will also help you to identify again and give a little clear picture about the lesions and the adhesion. Apart from this, we have biopsy. Uh, Laparoscopy is there, imaging tests are there, biopsy is also there. But biopsy, again, as I mentioned, it will only help you to understand that the that the percentage of the endometriosis is present. And last but not the least is the certain blood test, like we have the biomarker test, we call it, like we have CA125. Other biomarkers, like we have the interleukin 6, we have TNF alpha. These are the certain tests which are done. Hormone test that we do now, that is the if you talk about the lutein hormones, that can actually help you to only understand that how much the level is fluctuating, but
Okay.
it's cannot give you a clear picture that this, that means that this is suffering from endometriosis. Okay.
Okay.
I hope I am able to justify the concept of endometriosis and you people are understanding.
Ma'am, can you share any PDF regarding all this information?
Sure, I'll
So we
share it
can
to,
refer it later on.
yeah, sure, definitely. I'll share it to the people. They will actually share it to you all. Okay.
Oh, fine, ma'am.
Okay, dear. Anyone has any other doubt, they can they can unmute themselves or write in the chat box to write to say anything. And I would like to know one more thing. What is your takeaway message from this session about endometriosis? You can raise your hand and say, what is your takeaway message from them, from today? Anyone who want to say one takeaway message?
Ma'am, actually, I have actually gone through this endometriosis, so that is why I was asking you. So, actually, the problem is I have not listened to my body's signals and symptoms. So, this is my what I assumed is like through this, my lifestyle is like you need to understand your body's signals and symptoms and treat it as fast as possible because otherwise, it may really lead to other complications because it may affect the other parts of your organs.
Thank you, Josna, for sharing your thing. Thank you so much for opening up about this. Hema, I got your question, dear. It is that is there any correlation between retrograde uterus and the endometriosis? Okay, so yes, we have certain connection with it, and this is actually explained in theories, but still I would help you all to explain it again, that what is the connection between the retrograde uterus and the endometriosis. What happens is that uterus, you know, women who has this issue may have an increased risk of developing endometriosis, because as we know, the condition is associated with the hormonal and the reproductive factors like abnormal implantation and the inflammation associated with it. Now, if this retroverted uterus is not treated well, then it can be even more challenging to diagnose as well as to treat endometriosis. And This you can say actually more like that retrovert uterus is a one such triggering factor in the development of the endometriosis, because it's also seen that a retrovert uterus, if along with endometriosis, increases the risk of infertility and difficulty to get pregnant also, and can result in heavy bleeding also in the pelvic way. So these are somewhat connection we see between retrovert uterus as well as the endometriosis. But again, if the stage, it also depends upon the stage at which you find this retrovert uterus. If it is still found in the mild stage, it can be corrected using proper medications and your life, changing your lifestyle pattern. That need to be taken care of. Hema, I hope I answered your doubt, dear.
Yes, ma'am.
Okay. So, with this, I end my thing. Anything else you all want to share your feedback or something? You're most welcome to do so. We still have 5 minutes time. Then we'll move on. Then we'll end this session today.